If you've ever felt unsure about mouthpiece sizing or placement, worried about patient comfort, or questioned whether Isolite will work for patients with gag sensitivity, we're here to help. Most challenges of Isolite come down to a few simple technique adjustments. Let's walk through them, and then you'll practice with a teammate. If your patient's jaw feels sore during or after treatment, or you're not getting the tongue retraction you expected, it's usually a sizing issue. Have your patient open their mouth wide, but comfortably. Use the simple finger measure as your starting point. The interincisal opening will help you determine what size mouthpiece to use. But remember, anatomy matters. A patient with a deep floor of mouth or a high palatal vault may benefit from a DV version for better isolation. If you notice pressure on mandibular tori, try sizing down or place a cotton roll between the mouthpiece and the tori for added comfort. Like placing an X-ray sensor, technique helps prevent triggering the gag reflex. Start by lubricating the patient's lips and the mouthpiece. Using both hands, fold the mouthpiece. Insert at a 45-degree angle. Gently slide into the buccal vestibule on the treatment side, then slide the mouthpiece across the midline until the bite block is in place. Position it just distal to the mandibular canine, and then have the patient bite down. Small adjustments in mouthpiece size and placement technique can make all the difference. Just like taking radiographs, avoid pressing the mouthpiece against the posterior tongue or palate. If a patient says the mouthpiece is uncomfortable or their gag reflex seems unpredictable, pause and reassess. Often it's the mouthpiece size or placement technique, not the system itself. Confidence comes with practice. Use the Xyrus Customer Success Kit we provided with your initial purchase or your existing inventory to practice sizing and placement with your colleagues so you and your team can get comfortable before working with patients. When sized and placed correctly, most patients tolerate the mouthpiece extremely well, even those who typically struggle with gag reflex sensitivity. These challenges occur, and they're completely fixable with practice. Inside your free Isolite online learning program, you'll find troubleshooting tips, real patient scenarios, and best practices to keep your system performing at its best. Use the link below to log in. Isolite confidence starts with technique, and we'll guide you there.